Good evening, everybody. I hope that you've had a wonderful day. It has been so nice outside. I don't know about y'all, but I almost froze to death this morning. It's not even cold yet, and I had to put on my sweater or my wrap because I lost my sweater some kind of way. But this morning I had to go back inside and grab a wrap and put it on because it was freezing to me. Now I know you diehard fall people that can handle all this good old cool weather. Y'all probably like, man, that wasn't nothing. Hey y'all, I was cold, so I had to put on something earlier today. But now is that perfect time of the year where it's this fall smell in the air, the leaves, the trees. I don't know what it is, but this time of year to me smells better even than spring. And I don't get as sick as I do for spring, but I've enjoyed today. It was beautiful outside. I hope that you were able to get out and get a little bit of sunshine and move around just a little bit. Well, good evening, y'all. My name is Wonderlo, and I'm the host of the Ladies Lounge in Wonderlo, and this is the show. So, first, let me just welcome you if this is your first time tuning in. Thank you for tuning in. I appreciate everybody who watches on a weekly basis and keeps up with the stories and the people and the guests and chimes in and you ask a question or post a comment. I do appreciate you sharing the videos and sharing the post. That is always a good thing for me. I do love that and I do appreciate it. So, if you haven't already, do me a favor, go over to my Facebook page and it's the Lady Sounds Wonderlow, and like and share and follow. And you can also go to a YouTube channel and hit the little subscribe button and then hit the little bell so that you get the notifications when new videos are posted. So let's just get down to the business at hand tonight. I know you all have seen the post that I made earlier, and we were going to have some additional ladies on or another lady on tonight. Miss Parham had an emergency and couldn't be on tonight, so let's just keep her in our prayers. She had some things going on that she had to take care of, and that's always understandable to me. I'm not that person that gets upset when things go sideways. I know how to roll with it and keep it moving. So we just want to make sure that we keep her in our thoughts and that everything is going well for her. Um, tonight's show is about breast cancer, of course. October is breast cancer month. We had a show earlier that was scheduled for the month. We were going to talk about domestic violence. So, like I said, things have just been happening weird this whole month. But again, we're going to keep it moving and do what we can do. But tonight, we're going to focus on breast cancer awareness. I do have a guest. Unfortunately, we couldn't see her face, and she's a beautiful woman, but we can't see her face. But she's going to give us some information about early detection, about mammograms, about whether MammoVan is going to be next. And let me just give you her name. Now, not going to try to tell you her title because I'm going to tell you now. I'm going to mess it up, so I'm going to let her do it. But my guest tonight is Miss Heather Kindy, and she is with the UAMS MammoVan. So let me go ahead, Heather, and just give you a chance to tell people about yourself and what you do for UAMS Breast Care Center.
Yes, I have been with UAMS since the beginning of our mobile program, which started back in February of 2010. Um, we have given me the title of supervisor, which is sometimes a blessing and sometimes a curse. But we are a screening mobile unit. We travel throughout the state of Arkansas, set up and do mammograms. We do have a website. If you go to uams.edu and then just type in MammoVan, it will bring up some different links and articles. On there's a scrolling schedule of our upcoming events and a little bit of just, information about our program. We do have patients call in advance and schedule. Especially now with COVID, we do our best to kind of keep the coordination on the van so that we don't have multiple. So our 1-800 number is on that link if anyone is interested in trying to find us at one of our events. And like I said, we do travel throughout the entire state. Our objective is to hit the more rural areas or counties that don't have a mammogram facility. But we have learned, even if you have a mammogram facility within your county, it may still be miles and miles away. You or a family member may have unfortunately had a poor experience with the facility and don't necessarily want to have your care there. Some facilities are, open Monday through Friday and do screenings, throughout the whole day, provide, the diagnostic biopsies, ultrasounds, and then other facilities do not. And so, depending on where your area is, may decide your best place for care. But we are a screening unit, and so what your screening mammogram is your annual yearly mammogram. You're presenting with no issues or concerns or problems. You're just wanting your preventative annual mammogram. We do still continue to recommend those beginning at age 40. If you have a strong family history, which we consider that a first degree relative, which would be your mother, your sister, or your daughter, then you should definitely visit with your practitioner to see if getting a screening earlier could be advised. And of course, at any age, if you have any concern with your breast, you would want to visit with your practitioner to address and see if that needed, any kind of evaluation. I often am asked, we talk about when we start mammograms, but we've received, a lot of questions about, well, when should I stop having my mammogram? And we don't have a magical, we do not have a magical age for mammograms to stop. What we explain to patients is that the purpose of your mammogram is to find something and treat it. So if you are at a point in life where we were to say we have found this mass that does need further procedures, would you go through chemo? Would you go through radiation? Would you have surgery? And so when you get to the point where your answers are no to those, then, you would not need to continue with your screening mammograms, because that's kind of the point, to find it and treat it. So,
go ahead.
No, I just said that's kind of our program in a nutshell.
Okay. So where are some of the places that you go and set up? I know that you just said that you just came from Stuttgart today. So where are some other places you have on the schedule to go and set up here soon?
Yes. We have been, throughout our month here, we went to McGee for the first time. We've been to Fordyce and Hazen and to Jacksonville. Those are all events that we've done. Today we were in Helena. This coming Thursday we are in Dumas, and this coming Friday, the 22nd, we are going to be set up at the State Fair. So we have lots of ladies already scheduled for all of our events. Probably since about the beginning of summer, our events have become fully booked, along with sometimes even a waiting list, which is wonderful, that women are out and they're taking care of themselves.
Yes.
I think a portion of that is last year, some probably didn't get their mammogram for fear of COVID. And this year they're kind of trying to catch back up. Or they just don't want to have to go into the actual hospital setting. And so coming on the MammoVan in and out with, like I said, maybe one other person, they feel a little more comfortable with that atmosphere.
That makes sense.
So those are good things. But in general, like I mentioned, we do try to target counties that don't have a facility, but we still have found that even if you have a facility, our services could be still needed. We set up at churches, banks, community centers, physician clinics, just really anywhere and everywhere that we have a good champion within that community to kind of help get us out in the community. Someone that knows the places, knows the areas, tries to help recruit patients. We also do what we call worksite wellness. And we will set up at a company or a corporation. And that works out really well because the employers are, have workers that are using their benefits. They're staying healthy. Employees are happy because they can come out to see us for 15 or 20 minutes. Most employers don't even make them, lose or miss time. And they're only out with us 15 to 20 minutes versus having to take off a half day or a full day. So it's really a win-win for both the employer and the employee.
Mm-hmm.
So we try to incorporate those as well. We are very fortunate to work with a program in our state called Breast Care.
Mm-hmm.
And that allows us to sign ladies up, 40 and over. And we ask a few questions about, income and number of people in your household. We can't put you on that, of course, if you do have any other type of coverage.
Mm-hmm.
But that coverage is wonderful. We are able to sign a lot of ladies up on that do not have coverage. That covers your screening mammogram, as well as any kind of follow-up for a diagnostic or an ultrasound.
Mm-hmm.
And then it also allows a Pap smear each year, along with follow-up that comes out of that. So,
okay.
A very wonderful program that we're fortunate to have here in our state.
Yeah, I didn't know about the Pap Smear part of it. I've actually used the program myself to do the I almost said the MammoVan, the mammogram. So I've used that part, but I didn't realize it included Pap Smear. Okay.
It does. Like I said, it's a really good program to cover both the Pap Smear and the mammogram. And they will cover ladies too. They're under 40, or if you're having the diagnostic issue and you're needing to go in and address a lump or something. They don't just cover screenings. They're good to cover a lot of things.
Okay.
And they work pretty directly. They're through the health department, so they work directly with local health departments. And there are 5 different coordinators throughout the state that work with their areas to try to meet needs. So if anyone, needs assistance with that, they can always call us or contact your local health department and ask about breast care.
Okay. See, that's another resource I'd forgotten about that one. But like I said, I've used that before to get a mammogram. And it's very easy. They're very friendly. They take care of everything. The process was really easy. While you've been talking, I've been posting some of this stuff in the comments. So if anybody goes back later on and they want to know how do they get information about the MammoVan, and I put that website. And then I'm also putting the one for Breast Care Arkansas. So if they need information on how to get in contact with them also.
Wonderful.
Make sure that as many people as possible who need to get any of this done and taken care of can get it done. So,
and we've been very fortunate as a whole with UAMS. Our breast center has moved to the Cancer Institute, which has allowed them to expand, and they have some additional mammogram machines. The atmosphere and the ambience there is much more sort of calming, and they've got the nice waffle robes and the dressing rooms that you can more than just turn around in, and that's been a great addition, and that's been something I think that's been in the work for several years. So we're glad to have that opened up. We have also opened up a screening unit in the Midtown Women's Center. Okay. It's there off University, and they have put in a suite there with a mammogram machine. Okay. So if you're there to get your yearly Pap smear or discussion about hormones with your physician, and they now have that opportunity to offer mammograms there. Okay. And that's with a couple of the OBGYN clinics within Little Rock, and I think that's great. If you can couple a couple of your exams together, I think women are much more likely to get them done versus having to schedule multiple appointments and go multiple times.
Exactly. Multiple locations.
In multiple locations.
I like pop shopping, so that sounds good.
Yes. So if you have an OBGYN, definitely, visit with them to see if they're offering mammograms there as well.
Okay. Well, y'all, let me make just to be so you all know, we were not going to have a long show tonight since we didn't have our survivor on. But I want to make sure that we came on and Heather just gave a little bit of information about the MammoVan, the importance of, getting those mammograms done, where they're going to be and how to access that information. So I think we've covered pretty much that. But I do want you to just hit just a little bit and then we're going to call it a night the importance of the early detection, as far as treatment and everything goes, and then we'll be done.
Yes. So, unfortunately, breast cancer is the second leading cause of death behind skin cancer, which is really scary. And we are so fortunate to have this more modern technology. It has shown that you have a 40% more rate to survive if you have your annual mammogram.
Okay.
So it is very much been proven through the years that your annual screening mammogram has definitely a benefit. Your diagnosis is going to be at an earlier stage, which is going to give you that higher survival rate. A lot of ladies will say, well, I don't have a family history, so I don't feel like that's an issue. Unfortunately, as our breast cancer has evolved and changed, a lot of it now is due to our atmosphere, what we eat, different hormones, the foods. So we're not necessarily seeing a lot of these genetic breast cancers now. We're just kind of seeing them, here and there. So your family history, while it's definitely important, the lack of that family history should not deter you from having your annual mammogram.
Exactly.
We also recommend that women do their monthly self-breast exam. We have several pamphlets, I'm sure online you could easily Google, but it will give you a good self demonstration and how to do that. When is the best time each month to do that? We have some literature. It's my favorite literature that we give out. It has like a hook on it and it's waterproof, so you can stick it in your shower because that's the best place to do it. And it even has a punch out for each month, so it helps kind of keep you on track to know when you have and haven't done it. But that's one myth that we hear a lot of is, I don't have a history. And then a lot of people will also say, I don't feel anything. And the portion of, or the part of the mammogram that's helps you with that earlier detection is that you find that breast cancer before you can feel it. So it's millimeters in size, not centimeters in size. That's why if you do your self-breast exam each month, you're more likely to find a smaller nodule than if you just periodically do it or here and there.
Okay.
There are also types of cancer that don't come in a lump form. There's some different microcalcifications, and those are something you would absolutely never feel. They would only show up with regards to your mammogram. Okay. There's also some different type breast cancers that are involving more of the skin and nipple area. And again, that's something that you need to be self-aware of, visit with physicians if you have any, concerns or anything new. I always try to tell patients that you're your best nurse. If something's different or changing with your body. Hopefully, everyone can receive good care, but if you don't feel like you're getting good care from that practitioner, we fortunately have plenty in Arkansas to choose from. So don't let that be an issue as well. We continue to have advances with mammography. We now have whole breast ultrasounds. So if you're at a high risk, if you have a strong family history, sometimes that whole breast ultrasound will be in addition to your annual mammogram. So it's just another tool to help, look. Of course, we have breast MRIs that sometimes are done in addition to your annual mammogram. Both ultrasound and MRI can also be used if there's a concern or issue as well. I'm sure everyone has heard about the 3D mammography equipment. When that first became kind of the newer thing, a lot of ladies unfortunately thought that meant they were not going to have to be positioned and compressed. And unfortunately, that part of it has not changed. The image quality, it's wonderful. So we definitely have quite a few advances over the last couple of years. And of course, we assume that will just continue. But we 100% go for early detection.
Yes.
Getting your mammogram is going to find any kind of nodule earlier, and then, like I said, there's some that you would never feel on your own.
Mm-hmm.
We are fortunate that most insurances have preventative services, so most annual mammograms are not any out-of-pocket expense to the patient. There's different, certain hospitals will let you pay off things. Some may have grant funds. So there's lots of issues. And then, of course, the breast care that I mentioned. So here within our state, those barriers of finance, we really do try to eliminate. With our particular mobile, it's, any type of travel issue. If you have a fear of having your mammogram, schedule it with a friend or a family member. Go out to lunch afterwards, or treat yourself to a manicure. Make it, to where it can be a fun experience if that's what you need to do.
Yes.
We have a lot of first-time patients that come in and they leave saying, "That's it? That's what I was so worried about?" And I'm like, yes. I mean, it's not something that's super pleasant that you want to have done every day,
No.
but it is for a few seconds that you're in compression.
Exactly.
And it could save your life. So I always tell patients, be sure you talk with your technologist if you're uncomfortable, if they need to reposition. Just always, try to communicate as best we can, because we want to get optimal images. Like, that is our objective. We have to get a good image so that if there is something there, it can be found. But
Yeah.
that's in addition to making the patient comfortable and having an experience that makes them want to come back.
Exactly.
So,
Well, I will say from experience, it is not like you said, it's not a comfortable thing to have done, but it does save your life, or it can save your life if you go ahead and get it done. And my only request every year or every time I've had it done is just warm up the plates before. It's always freezing cold, and I
it
get
is.
cold really easy, and it's always freezing, and I'm going, okay, this would be better if you just warm it up just a little.
I
You
agree.
clamp down on me. I mean, I can handle the rest of it. It's just the coolness that gets me.
It is, and it's really no matter if you come in the summer or winter. It's just the nature of it, I guess.
Mm-hmm.
But I think through the cold months, nobody really wants to have to come in and undress and have that for sure.
No. Just real quick, talk about a couple of the symptoms that we need to be watching for, because most people, I'll just say probably most women or most men, because we don't ever acknowledge the fact men get breast cancer also. We don't think about it. I shouldn't say we don't ever acknowledge it, but sometimes we don't think about it. What are some of the symptoms or some of the signs if you were checking yourself and you noticed that there's something different about your breast? What are some of those things that we could notice that might get us to go, let me go get checked out?
Well, of course, always the obvious one is if you can feel any type of lump or mass.
Mm-hmm.
A lump or a mass doesn't necessarily mean that it's going to be a cancer or anything wrong. There are several benign masses. There are fluid-filled cysts. But obviously, if there's anything that you can feel differently within your breast, it's something that you need to voice to a practitioner. A lot of times we'll get patients that have overall just breast pain and tenderness.
Mm-hmm.
We will typically tell the patient if that is diffused throughout the whole breast, in both breasts, that could possibly be a new medicine, a different change in your diet, or even if you are out like working in your flower garden, if you've been lifting some heavy equipment, there's
Mm-hmm.
several muscles that attach there with your breast tissue.
Okay.
So that can be part of your pain and tenderness. If that continues, if that's not just a here or there or kind of an occurrence that comes and goes, definitely always visit with your practitioner about that as well. If you have pain that is pinpointed, you can take one or two fingers and say, I have pain right here. It's constant. It's worrisome. We would definitely want to talk with your practitioner about pinpointed pain.
Mm-hmm.
If you have nipple discharge, whether it's upon like compression and expresses, or if it's something that you just find, within your bra, that's something you want to visit with your practitioner about.
Okay.
We also always, part of your monthly breast exam is a visual exam.
Mm-hmm.
If you notice one breast is becoming much more larger than the other, we have what we call an orange peel look. So if you were to look at an orange,
Mm-hmm.
the skin of it, how it kind of has the dimpling and the holes, and it's not your smooth surface breast tissue.
Mm-hmm.
If you notice any type of visual changing with your skin, um, kind of along with the nipple discharge, if you happen to have a nipple that becomes very itchy, or it scabs over, or has any type of opening, anything along those lines would definitely warrant a appointment with your physician.
Mm-hmm.
We always tell patients part of your monthly self breast exam is to check in your axillary underneath your arm. Those are where your lymph nodes stay. And so if you have any enlarged lymph nodes that become tender, would want to visit with your doctor about.
Okay. See, all of those are things that, like you said, every month, if we're doing our breast exam, we should be noticing. And just in general, because I noticed I've had some tenderness before, and I panic real fast. And I'm like, soon as I get to the doctor, hey, it's hurting right here, and he'll go, okay, calm down. And because I'm a little bit more dense in the area than some women, I have to go. It's a little bit more difficult sometimes for me to get my mammogram, but she takes her time, and they usually work around, and they get it, and they make sure they take really. But I'm speaking for my ladies that are kind of like me. We're a little top heavy.
Mm-hmm.
It is a little bit more difficult for us sometimes to feel, because we do have a lot more breast tissue. So you have to really be, on it, to be checking yourself every month, and be doing it continuously, and be doing it, be persistent with it, because sometimes, because of the size, it's a little bit harder for us to maybe feel something. So I am adamant about making sure that when it's time for me to go get my mammogram, that I get it done, because even with me checking, I'm always afraid, what if I miss something?
Yes, that's we kind of call it the trifecta: the monthly self breast exam, your annual mammogram, and your annual breast exam by the physician. Those are your three things that you need to do your best to combat any type of breast cancer.
Yes.
And I do agree with women that are more larger breasted, or just have denser breast tissue, that self breast exam can be much more challenging.
Mm-hmm.
We just try to always encourage patients, anything that you're doing is better than nothing.
Mm-hmm.
And just try to learn your breast tissue,
Right.
what's normal for you, so that if anything did change, you would be a little, that would be something that you could be aware of.
Amen. All right. Is there anything else you think that we ought to know, so we can take better care of ourselves?
No, I think all of us know to incorporate some exercise, and probably eat better than any of us do. And just know, as you age, where your preventative exams come in.
Yes, ma'am. All right. Well, I do appreciate you, lady, for being able to hop on for just a couple of minutes tonight. Again, make sure that we keep Miss Parham in the thoughts, make sure everything's going good with her. I will probably have a different show on a different night, because I still want her to be able to come on this month. Excuse me. Who is scare her testimony of surviving breast cancer. She also gave me the name of another young lady. I think I'm going to contact her also. So we might do them another night of the month before October is over, because I really want her to share her journey with everybody. But Heather, thank you so much. I think every year I call you, you show up and you do a great job, and I so appreciate that. So y'all, we did a 30-minute show. Exactly. It's 7:29. By the time we finish, it'll be 7:30. So let me just say this. Make sure you all tune in next week. I'm going to have an author on. She's a writer of children's books, and she has a new book coming out, and she wants to come on and talk about that, and kind of give us some ideas of what the journey is to becoming an author. And she'll also have a friend on who's the publisher. So she'll be giving us a couple of tips on how to publish those stories that have been running around in our head that we finally get the chance to put down on paper. So make sure that you tune in next Tuesday at 7 p.m. In the Ladies Lounge again, so you can get that information on publishing a book and a new author that's going to be talking about her book. As always, thank you all for tuning in. Thank you for your support. Make sure that you go to the Facebook page and like and share. And then make sure that you also visit us on YouTube and subscribe and hit that hit the little bell so that you can get the notifications when new shows are posted. Heather, thank you so much. I know you need to go get some rest because you've had a long day. And I have too. So thank you very much. I appreciate you coming on.
You're welcome. Thank you for the invite.
Oh, no problem. All right. You have a good rest of the evening. And y'all, I will see y'all again Thursday. Make sure that you tune in Thursday because we're going way down south. I have a really good meal that I have planned to cook for you on Thursday at 7. It'll be on my personal page, Wonder Ben Low. So make sure that you go over and visit that page and watch that show. So it'll be May Rose Cafe Live. That's the name of my kitchen, y'all. May Rose Cafe Live on Thursday at 7 p.m. And we'll be going way down south. So make sure you join me and we'll have a good meal and some good stories. So thank you again for tonight and we will see y'all later. Bye-bye.